John Ray published a book called Flow Boy. It's about an adolescent boy who has schizophrenia who got released from the hospital. He decided to go on an adventure in the New York subway tunnels. On his adventure, he explored the subway tunnels, which represented the dark places of his mind. And on this adventure, his hallucinations and delusions got increasingly worse. So you wouldn't know if he was talking to a human or a hallucination. Schizophrenia is a disorder that involves hallucinating and has different causes, symptoms, and treatments for everyone. Today, I will share with you the different causes, symptoms, and treatments for schizophrenia. There are three main causes for schizophrenia. It is genetics, brain chemistry, and the environment. Genetics play a small part in this, but overall, it can create something big. There are different genetic makeups in our body that may have a small effect, but can result in one big one. Our brain chemistry is another thing. There are different chemicals in our brain that control behavior, thinking, and our emotions. And sometimes the chemicals are either too active or not active enough. In our environment, that is one big thing. We go through some stressful and traumatizing things, and they also are able to get infections before birth. And some of these things can trigger schizophrenia in our young adult to mid-20s range. Schizophrenia often surfaces during hormonal changes, and that's why they pop up during those time periods. While the causes for schizophrenia may seem very clear, the symptoms can widely vary from person to person. According to the Mayo Clinic, symptoms include hallucinations, delusions, disorganized thinking, abnormal motor behavior, and negative symptoms. Delusions include beliefs in reality that you may think that you can fly, or you may think that you're really famous, but you actually aren't. Hallucinations are when you think you are hearing something in your head, or you think you can see something, like maybe your mom that passed away like 5 years ago, you think you can see her. Disorganized thinking is when we get to the communication part of it. You may ask a patient with schizophrenia a question, and they may completely or partially answer it, but it's going to be completely unrelated to the topic. Abnormal motor behavior is when they may be acting like a child, or they get agitated really easily, kind of like a toddler would when you take something away. Negative symptoms are the emotion part of it. So they're going to lack emotion, they're going to lack facial expressions, they're not going to make eye contact, and they may also neglect their personal hygiene. So they're not going to do their day-to-day things like brush their teeth, brush their hair, or even shower. While there are many different symptoms that show you have schizophrenia, there are also many different treatments for this disorder. WebMD states that the main ones are medication and psychosocial therapy. Medications, the main one is antipsychotics, but depending on the patient, you might also add in antidepressants and anti-anxiety. Psychosocial therapy is when you are out of the psychotic stage, so you're not having your hallucinations and delusions anymore, and now you just have to normalize your thought patterns. They also do social skills training, which is when you want to do your daily activities again and get into that pattern. And they also do family therapy, which is educating your family on schizophrenia, so maybe you can prevent a relapse. Today we learned about different causes, symptoms, and treatments for schizophrenia. There are many, many more and this is just scratching the surface. This disorder is being researched more actively.